correct?
I am now. I just hit the button.
Okay. Just so you guys can, when we score your applications and it's all wrong how we scored it, you can come back and prove to us that we said something, I guess. I'm kind of in a joking around mood. I want you guys to know that while this is an application process, it's more of a cooperative endeavor that we have here. This application that we call the PFS 90,000 is only for the LSAA areas. This is not going to be opened up to anyone else. We anticipate, and it's our goal, that every LSAA will be funded. So please, take a breath and believe me, I get it. I don't want to discount any anxiety or anything that you may be feeling, because I get it. There's a lot riding on this, but also know that we're going to do whatever we can to help ensure that you have a successful application, and that the resources that are coming your way are going into a very productive process or system that will, help you guys get a prevention thing going that you haven't been able to get going in your areas before. So with that, I'm going to go ahead and go through the slide deck, and if you have any questions, I guess probably save them till the end. I can't see, and Logan, unless you can tell me how to do it differently, but I can't see the chat box or anything while I'm doing my slides. So can you see, Heidi?
Yeah, I can see it, so I can let you know.
Oh, yeah, I guess Heidi can see it. And by the way, I want to introduce to you Heidi Sterling, who is sitting here with me, and Heidi Peterson. We worked really hard to get duplicate names just to confuse everybody. Heidi is a new program manager here at the Division of Substance Abuse and Mental Health, and she will be managing this grant. So welcome, Heidi.
Thank you.
And you guys, she's coming down to Moab, so you'll get a chance to get her or get to know her there. So this Partners for Success, just real quickly, I've been a big advocate of the Center of Substance Abuse Prevention doing these discretionary grants, because I've seen what it's been able to do in our state. If you were back in the prevention system in 1996 even, or 1997, using the terms evidence-based wasn't that common. In fact, I would say that it was non-existent. There was a grant that was given initially called a SIG grant, S-I-G, and it was through that all of a sudden people started using different language and focusing on things. At that time, I was at Weber Human Services, and I was one of them that actually came into the prevention field along with this grant. I'd been in the treatment field before that, and I remember all the guys that were working in prevention at that time were pretty frustrated with the state because they were forcing changes on them, or they felt that they were forcing changes on them, and some of the things just flat didn't make sense. As an example, they started talking about doing these, it was a 7-step process. One of those steps included doing an assessment on your communities to determine needs. Well, the funny thing is that after we did all that, the state, really the feds, then said, but you have to focus on 12 to 17-year-olds. So it's just kind of weird. But the fact of the matter is that got us into the evidence base, I think, really threw us into the evidence-based realm. And not only our state, but I think the prevention system overall got ahead of the entire behavioral health system as far as endorsing or, using and applying evidence-based. We also had the SIG-E grant. That was a grant that went out to higher education. We did have a state epidemiology and outcomes grant in 2004 and 5. That, by the way, is what funded the analysis of the data that helped us understand the opioid issues, what we then just at that time called prescription drugs in the state of Utah, and pulled together, that data is what pulled together the first task force, so to speak, that the health department headed out on to do something with the SEO or with the opioid issues. Then we had the State Strategic Prevention Framework Grant, affectionately called SPIF. And then following that, we did have a kind of a fill gap. Is that a word?
No.
It is now. Yeah, they had a gap between grants, but we were able to secure some funding to help us through there, bridge through to the next grant, which was the Partners for Success. So really, it's all spiff. Every one of these has led us to increasing our ability to do the strategic prevention framework throughout the state. So the lessons for success. So these things are called Partners for Success for a reason. But basically what we've been told to do in Utah with the PFS grants is learn from the lessons that were given through all those other grants that we had, and then enhance those, sustain them and enhance them. So these are some things that we have noticed that, through the years with these grants. Is that number one, we need a very strong foundation working off of risk and protective factors. This has been interesting. We all know that we collect data on consumption and consequences, and there has been some grants that I felt really pushed us into even more of a harm reduction type of an approach if you really wanted to do something about the data we were collecting. As an example, some of the data at one time we were collecting was on DUI arrest rates, et cetera. And so if you wanted to reduce DUI rates, there's some things that you could do that don't even touch risk factors. So anyway, the short end of that is that we got to remember that for this really early upstream primary prevention, whatever you want to call it, it's got to be based on making a difference on the risk and protective factors. We also now know through the course of these grants that those risk and protective factors are shared amongst a whole ton, a good handful of outcomes that we're trying to either increase or decrease in communities to make them healthier. We know that sustainability is a big issue. A clear and consistent message in prevention is very valuable. In order to get sustainability, we can't rely on federal grants. We can't rely on the state. We got to make sure that local communities are buying in to doing evidence-based prevention. And buy-in would include not only attention by the key leaders, but also providing resources to be able to keep things moving when things get a little goofy. I will say that, first of all, what I mean by goofy is that we've lost state dollars from time to time. We've lost federal dollars from time to time. And if that's all we're going to rely on, then we're at great risk of having coalitions have the foundation underneath them just kind of get washed away. Part of being able to do that and getting more people to buy in and provide resources and capacity to the prevention efforts is to develop well-functioning, well-mobilized, and well-organized coalitions throughout the state of Utah. We've also learned that capacity cannot be ignored. Not only in the state of Utah, but looking at lessons learned in other states. There are states that continue to just put grants out on a competitive bid process every time that they get one of these discretionary grants. And so just as an example, in the first SIG grant, people had contracted with private and nonprofit providers to do that. That was actually a 3-year grant. With 2 years of possible no-cost extension, so maybe 5 years. But at the end of that 5 years, where do you think that all those companies or organizations went when the dollars dried up? There was just nothing left. And so if there are gaps in the federal dollars coming in, they're losing a lot of momentum in doing evidence-based prevention. So in Utah, one thing that we have learned, we have had some of that's happened, but not to the extent of other states. But we also know that, it's been kind of fun in a sense of being in a position where we're always talking about trying to get more dollars, which we still do, to be honest. But nothing like we have been for the past 15 years. And what we found is that sometimes we get grants in the state of Utah that we haven't been able to spend. And we don't have to look too far back in history to know when we turned back $250,000 a year because we couldn't spend those dollars. I know some of you are thinking, are you crazy? And I'm like, no, I'm not. We've had that happen. And it's simply because when we're trying to piecemeal these grants from grant to grant, it's hard to get long-term committed staff and a workforce that's there and will be stable in order to run these grants. So how do you spend the dollars if you don't have the capacity? How do you deploy evidence-based prevention in all the coalitions or communities in your areas if we can't stabilize that workforce? So that's the ultimate goal of this particular grant, these dollars that we're putting out now anyway, is to buy a little bit more time that we can leverage and find additional dollars that are more stable than the discretionary grants. The prioritization is a big piece of the strategic prevention framework, but as we build capacity in the state of Utah, just kick around in your head a little bit. Really, the only reason to prioritize is if you don't have the capacity to do the services. If we had enough dollars to have coalitions in all of our communities in the state, as well as doing, the resources to purchase evidence-based programs and to do all the other things that we're doing with the environmental strategies, et cetera, we could do that. There would be no reason to only do 3 communities in your LSAA area if you had the resources to broaden that out. So we're seeing this again as another step in that process of being able to do it. The Partnership for Success Part 2, that's where we're at right now. It's a 5-year grant. The total award is $2.2 million. That's per year. The objective of this grant is to decrease underage drinking. The feds have extended the age range, you can see, from 9 to 20, and also following the data to decrease youth marijuana use in our state. Please note that doesn't mean that another priority that we've had for several years, the opioid issue, it's still a priority. But as part of the strategic prevention framework, you know that resource assessments is part of what we do. With a number of resources going into the opioids, it was clear that these dollars ought to be reserved for something else. And which, by the way, speaking of capacity, to be quite honest, it doesn't even matter what we're targeting, because if we're building capacity, we're going to make a difference in all the different substances or other negative outcomes that we're looking at. There are 2 local substance abuse authority opportunities for these funds. One of them is the capacity building grant, which is what we're talking about today. That's up to $90,000 per local authority. There's also going to be funds that will be rolled out later. The amount of that and how that will look will come later. The funding amounts in each LSA, we're going to do the $90,000 for up to 5 years. This ends at the end of September in 2023. The required activities are to strengthen the prevention capacity. That's what we're really looking for. All these other things kind of focus or are a piece of that. The increase the workforce, this has been a long-standing request or observation by not only our office, but the prevention network as well. I remember, and I think folks on the call will remember too, when we were shocked when we first learned that not every local substance abuse authority had at least one prevention coordinator that was full-time. I think that the local substance abuse authorities have done a really good job of ponying up and tin cupping and doing all this work to get more full-time coordinators. But another thing that I've learned recently is that even some that are full-time are not full-time on solid money. And so that's what we want to first make sure is addressed, is that there's adequate staff to coordinate the efforts within the local substance abuse authority. Again, this grant will give us another 5 years to find even more stable funding. But if you add to that the last grant, which was 5 years and basically moving towards that same target, that really, between the 2 grants, has given us about 10 years to get something in place. So we're on the downside slope of trying to get something, whether it be state general funds or other funding, to make sure that all of you guys have a strong foundation of money underneath you and you don't have to worry about having a job in 5 years or not. There will be quarterly reports on the impact of the LSAA. Those templates will be given out at a later date. We don't have those yet, but for each one of these PFS grants, we are required to do reports that I know that some of you are already aware of with the current PFS, and I can't even think of all the acronyms that we use to get the reports from you. Let's see, the last one on there, leveraging local resources for prevention. That's a critical piece of being able to build the capacity, and it's also a critical piece of what coalitions are all about anyway. So in your applications, that will be something that we're looking at and we'll continue to assess. And we're looking for some really successful stories or areas that have been able to leverage resources in order to provide, whether it's a community or your entire area, prevention services in that spot. The prohibited activities. Notice that purchase of program materials. If you need to purchase program materials, we view that as something that you need to use your block grant or other funds, including some of the other funds from this grant that we'll be pushing out later. Please don't put in your applications on this one that you need these funds to purchase program materials. These funds are also not to be used for naloxone or any other kind of harm reduction materials. That's for two reasons. One, again, is a resource assessment shows that the SOR, STR has a ton of money, literally millions of dollars that are available to do that. And the feds prohibit it on this grant anyway. So make sure you're not going down that path with these funds. And also, as usual, any kind of treatment services. There's been a thing that we've held to throughout the years, and that is the difference in prevention and treatment dollars and where they should go. The prevention dollars should never go towards services that somebody who has a diagnosis or should have a diagnosis. You should send your intent to apply. We have received a good handful of those, but if you're going to apply, please let us know, and no later than in a couple of days, which Friday at 11:30. And your grant applications will be due Monday, December 10th. And please note, I think we're very creative of making 11:30 a.m. just to not confuse anybody between noon and midnight, which has happened in the past. So it's 11:30 a.m. And also your grant application, for those of you that act like me and won't do anything with it until Monday morning, December 10th, you've got a few hours to get it done by 11:30. And you have the weekend too if you have to do it that way. Make sure that you're emailing all of us, CC all three of us. Heidi just started yesterday, Heidi Sterling, so we don't have her on this, but we'll get her looped into all that. But make sure that you email everything to the three of us just to make sure that somebody's getting it. Also, make sure that you get receipt notification. So one of us should get back and say, got it, or something along those lines. And that's your responsibility. If you don't hear anything back from us, please make sure that you pester us long enough to get it. The application, we figure, is 10 pages max. Again, we're not trying to create anxiety. This allows for an org chart and things like that. So we're not expecting really narrative intensive applications here, but we just need enough to know what you're proposing to do with the dollars. And by the way, as I'd mentioned before, we need to know enough in your application of what you intend to do, so that number one, we can go ahead and fund you, or number two, our regional directors can work with you in a cooperative fashion to get it to a point that we know matches up with the grant and the needs of statewide. The next few slides, we're going to talk about what the responses are that you'll be addressing, and also what the reviewers will be looking for in your applications. The first one is to define your LSAA. And for the next few slides, you'll see that the right column is what the reviewers will be looking for. I didn't put that on each of the slides because I couldn't quite figure it out, but I got to work once, so I left it there. And a lot of this is really straight up. I mean, the name and demographics of your LSAA and also the LSA prevention system org chart, those are what you need to respond to. So that's what the reviewer's looking for. Your priority communities for prevention services, make sure that that you do identify that, whether that's your LSAA overall, or some of you may choose to make a case that within your LSAA you have 2 counties or 3 counties that you're focusing on, or you need to hire staff to do work within 2 coalitions or a coalition, whatever that is. But you need to list those out, and if there's multiple areas that you want to make the case for, make sure that you, first of all, name the population and the demographics of each one of those populations that you're trying to target. You can include a table, and we're looking for, you need to include a table, and what we're looking for is that it clearly demonstrates why you chose those populations. That could be, in my opinion, if they're at elevated risk factor or lower protective factors in other areas within your LSAA, or compared to the state, or however it is that you want to do it. You could also make a case for the capacity issues as well. Make sure that you're identifying what those capacity gaps are. Remember that this particular pot of funds is to build the workforce capacity. We want to see that whether you're going to hire 1 person or 2 people, and to be quite honest with you, if you want to try to make the case that you don't want to hire anybody, you could do it, but we're gonna have a really long talk before any movement would be done in that way. Remember, this is the 90,000 only. You'll have opportunities to purchase other things later, but man, we just got to get that capacity, that workforce capacity, really strengthened. And I'll be honest, it'd be a hard sell to try to move any of that, or to refocus these dollars and other capacity issues that you may have. Your third question is your proposed project, so make sure you outline that. Include job descriptions for any proposed staff that you have, or that you want to hire with these dollars. And explain how this project will decrease youth marijuana use and underage drinking. And quite frankly, you can make the case, and probably should make the case, of how this project will decrease all substance abuse prevention. And make that really simple. We're not looking for a thesis on this. It actually is a pretty simple answer, in my opinion, as to how having an adequate or a more adequate workforce in your prevention system will have a decrease on these negative outcomes. Provide a timeline for implementing the functions. And this is something that I personally will take a really good look at. We want to make sure that it's not too ambitious, and yet you're not putting things out so far that we're not going to be able to do the outcomes that the feds are expecting us to do within the time frame that we have at the state. So use your experience. You guys know your systems and how long it takes to advertise and get a job posted and get somebody hired. So use that knowledge that you have and submit that. Your list of expected short-term outcomes. Obviously, I think that with short-term outcomes, we're looking at process data, especially in a grant like this where it's all about workforce. So think along those lines: how many people you expect to hire, how many hours there will be working, or whatever. And there might be some opportunities to expand that a little bit. And then also what your plans are to evaluate this particular grant. Heidi Peterson had just put out a budget template. Make sure that you take a look at that. For those of you that might want to try to make a case of justifying budget that would go into other capacity issues than workforce, as an example, it might not take a full $90,000 to hire one full-time or two part-time or whatever. And if there's some dollars left and you want to make a case of using those dollars in another capacity building endeavor, make sure that you explain that within the budget. And by the way, you'll see the little questions at the bottom, and those are to kind of spur some thinking to help you understand, or at least help you write your application. And that's it.
We do have a few questions.
Okay, here we go with questions.
Okay. Jen asked if the letter of intent that she sent last month after our previous UPN meeting, if that counts. And I told her that yes, it did.
Yep.
So I think there were a handful of you that sent in early responses to that. So you're covered if you did. The next question, Craig, from Robin, is can the funds be used to train instructors to provide programs?
Yes.
Okay. Who are the RDs and what areas are they covering?
They're not hired yet. We do have Rob Timmerman. He's solid. And Alan Sane is continuing down in the Southwest area. We're in the works right now of getting the other contracts. I think that the allocations have been made to Four Corners and Weber to help us, basically house RDs in those areas. But as far as where they will be serving, I think it's premature to come out with it because I don't know that that's solid yet. As soon as we get the RDs hired, I know that there's advertising that will be hitting really soon. I think maybe today or tomorrow, some advertising for those RD positions will be released.
Okay, next question from Heather Lewis. What are the other supplemental forms besides the organizational chart?
I don't remember any off the top of my head. Job descriptions. So the org chart and job descriptions, and
I'll do some additional checking on that one as well. Robin Hatch also asked if we get the 90,000, by what date does the first year have to be spent?
September 30th or 29th. And you guys know that we have to monkey around with the state and federal fiscal year. And so there'll be an allotment that will get you through June 30th. Any dollars that are not spent by June 30th would have to be rolled over, which then would have to be spent by September 29th. So we'll work with you on figuring out what the differences will be so we don't have to mess around as much with the rollover. I hope that makes sense, because I don't know if it makes sense to me. But that's the new rules that we operate under, and your finance people are aware of that.
Okay, Logan was asking for the official RFP template that was emailed out, what, 3 days ago? Friday, I guess.
Yeah, Friday.
If you have not received that, please let us know and we'll make sure to get that out to you. Kit Curtis asked what Heidi Sterling's email address is, and do we have that yet?
Not 100% sure yet. That's going to be H Sterling, and Sterling is spelled Stirling, so it's H Sterling at utah.gov, I believe.
H Sterling.
Mm-hmm. Yeah, and thanks, Kit. And as soon as we get that nailed down, we'll have Heidi send out an email to everybody and just give you an opportunity to get to know her a little bit. I'll just take a moment. She's from Salt Lake County and had been working up at the Graduate School of Social Work at the University of Utah. Woohoo! I'm an alma mater.
Heather Lewis wants to know what she looks like.
Heather!
Snap a picture.
Why does that matter?
I'll send a photo.
Come to Moab.
There you go.
Yeah, come to Moab, bring your bikes.
Robin Hatch is also asking, is a 10% administration cost allowed?
Yeah, sure. If that's what the normal one is, whatever normal for administrative costs, Robin, and certainly Kyle will know that for sure. But yeah, that would be appropriate to do that.
Robin says Kyle wants 15%.
Kyle.
Jen asked, if we hire coalition coordinators, can this money cover their CTC training?
Yes.
Any more questions? Heather says thank you. She appreciates the clarification with this grant. We hope that it's helpful.
Okay, you guys, I just want to, one last time, if there's anything I can say to reduce your anxiety. We don't want anxiety before Thanksgiving.
Is Puff Daddy growing the hair back out?
Is Puff Daddy growing the hair back out? Who wrote that?
David.
Thanks, David. But no, I'm where was I? Yeah, don't get all anxious. I give you my word that our attention is focused on these dollars, for now, to get this out and to help you guys be successful with it. I do want to mention that, or at least maybe hit on a point again. We've had 5 years to build capacity. We've had a good amount of money from the first PFS grant to start that process. So we're into this 5 years. We've had a lot of discussions with the Prevention Coordinators Network, with the Utah Prevention Coalition Association. We've talked a ton at our summer summit, at fall conference, at the network meetings, et cetera, about what we can do to try to find more stable funding. And, the time is upon us. The 5 years will be up before we know it. And so I would really encourage you to be talking with your directors and anybody else that you need to, your supervisor, directors, however that works within your area, to help them understand that it really is hard to run a system when we're not even half baked as far as funding goes. We're woefully low, and until we can get that stable funding to provide a workforce that's stable, I don't think we'll never get to where we know that we can be as far as the effectiveness of the prevention services throughout the state. So the time is now. Let's don't wait any longer. Let's continue to have those conversations and think through and utilize the mechanisms in place, including UBIC, the Utah Association of Counties. I think that the state health department system is very interested as well as building prevention systems and infrastructure. And then through UPAC, we have Rob Timmerman and Susanna Burke co-chair that, which then leads into USAVE, which is the policy recommendation entity for the governor and the legislature. So please be thinking along those lines and helping coalitions understand the need to jump on board to help support those kinds of things. And we'll get this nailed down as fast as we can and be able to sustain. That's certainly where we want to be, is we want to sustain any position that we're starting with these dollars with a more stable source of funds. So I think that's it, folks. I greatly appreciate all that you're doing out there and your willingness to apply for these. And if you have any questions, make sure that you email any questions or comments or even thoughts to all those of us that are listed on the grant. All right, thank you guys, and we'll see you later.